All right, so I wanted to say good afternoon and welcome to today's presentation. We're really excited to have you joining us for this important talk, Supporting Mental Health in the Public Sector. So my name is Jamie Mayoh-Bauche, and I'm an instructional designer with Johnson Shoyama Graduate School of Public Policy. So I'm really excited to welcome you here to today's event as the moderator. The Johnson Shoyama Graduate School of Public Policy, or JSGS, is a national hub for advanced study and research in public policy administration. We're a partnership between the University of Regina, where I'm based, and the University of Saskatchewan that was based on the spirit of cooperation and collaboration that defines Saskatchewan. Since our inception in 2007, we have swiftly become one of Canada's leading policy schools for educating graduate students and public servants interested in and devoted to advancing public value. I know we have some of our students here today, so welcome to you as well. At this time, I would like to acknowledge that while today's event is taking place online, JSGS's physical homes are located on Treaty 4 and Treaty 6 territories, the original lands of the Cree, Ojibwe, Saulteaux, Dakota, Lakota, and Nakota, and the homeland of the Métis. In addition to these territories, today's speaker Kabir is joining us from Langley, British Columbia, which is situated on the traditional lands of the Coast Salish peoples. And in particular, settlers living there acknowledge their relationship to the Katzie, Kwantlen, Matsqui, and Semimo First Nations. Lindsay is joining from Ottawa, Ontario, which is built on the Anishinaabe-Algonquin territory. The peoples of the Anishinaabe-Algonquin Nation have lived on that territory for millennia. Their culture and presence have nurtured and continue to nurture the land. And we're glad to welcome all of you joining us today from across Turtle Island. We make this land acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on or are visiting. I welcome you to take this next moment to reflect on the land you reside on. Maybe think of somewhere in particular that you like to go when you get outside and connect with the land to relax, to enjoy time with your family or your pets. Think about and express gratitude for this place and the people who have safeguarded it throughout time. And I also think it's important when we do the land acknowledgements to think about, you can share your land acknowledgement if you want in the chat. And as you're doing that, think about concrete ways that we can, or actions that we can identify that will allow us to actively engage in reconciliation and honor the land and its people. So for those of you new to the EDI discussion series, I'm really happy to welcome you here today. This is an entire series focusing on engaging current and future public servants on issues pertaining to equity, diversity, and inclusion in the public sector. This series is proudly supported by the Max Bell Foundation, who encourages the development of forward-looking innovations that impact public policies and practices. If you'd like more information on the Max Bell Foundation and their work, please click on the link in the chat. And it's a well-timed discussion as well, because it is Bell Let's Chat Day, which is an initiative aimed at raising awareness of mental health and especially discussions of mental health in public forums like the workplace. So today's discussion will focus on the complex issues of mental health in the workplace and some of the ways that it interacts with equity, diversity, and inclusion. So the workplace can both undermine and support good mental health. And these efforts can be amplified by inclusion initiatives focused on other aspects of diversity. So there's a lot of complex interactions that occur within those domains. So in our discussion today, we will cover some concrete recommendations. I know that people are really interested in things that they can do to reduce stress, build psychological safety, promote good mental health in the workplace. And we will also address the increased challenges to mental health that are faced by members of equity-seeking group within that lens of EDI. It's important to me as well as an individual with a diagnosed mental illness that this conversation also goes beyond conversations or talk about mental wellness or stress to discuss those things that have been stigmatized, such as mental illness or mental health disorders, and talk about how we can support people with mental health disorders in the workplace and how those supports for those individuals can really help all people in the workplace, all of our employees. So in the spirit of safeguarding mental health, I do want to share a warning. So our speakers are sharing information here today on topics that can trigger or re-stimulate trauma for those attending. So we recognize the need for safety measures to minimize this risk. If you're experiencing distress as a result of anything in the presentations, please do what you need to take care of yourself. If you need to log off, if you need to come back later. And we will also be sharing links in the chat that you can access as resources in terms of ways to help address some of those challenges. So before we get started with our speakers, to help our event run smoothly, we just ask that all attendees stay muted and turn off their videos during the presentation portion of the event, which is what we're doing right now. Feel free to turn your videos back on for the Q&A, and that way you can get a little bit more face-to-face with our speakers. So our format today is as follows. Following the speaker introductions, we will engage in a moderated question and answer format. So I'm going to ask questions of Kabir and Lindsay, and they're going to give us some answers to help us dig into the broader issues. That will give you as the audience time to think about questions and inquiries that you would like to make of our speakers. And following our more formal initial portion, we'll open it up to audience questions and answers. If you'd like to ask a question, you can use the Zoom chat function to send your question to myself, Jamie Mayoh-Bauche, and I will read out your question to our presenters today. Feel free to submit questions anytime. So if there's something pressing and on your mind right now, you can pop it in the chat to me, or you can wait till the initial conversation is finished to see if there's things that come up for you. If you have logistical questions about today's event, don't hesitate to send a message to Karen Jaster-LaForge via the Zoom chat. So Karen has been the one posting links and different messages in the chat already. So you can direct message, write to her, or email her at jsgs.events@uregina.ca. So please note that with all of our EDI presentations, this presentation is being recorded and will be available for viewing on the JSGS website at a later date. So now with all of that logistical stuff out of the way, I'm so happy to welcome our speakers for today's presentation. I will start with Kabir Bhagaria, Senior Manager of Employee Health and Safety at First West Credit Union. Kabir is a well-seasoned professional who has a passion for employee health. He has had the privilege of working for several large organizations where he established employee health programs and launched various initiatives in support of health. Kabir also has a keen interest in psychological safety and how it relates to the workplace. And as we'll see in the conversation, that's such a big part of mental health in the workplace. When he isn't working, he loves to stay active and travel with his family and explore new cultures. In addition to Kabir, we have Lindsay Coffin joining us. Lindsay is the Interim Director of Human Capital at the Conference Board of Canada. She's been involved in several projects aimed at understanding human capital trends and the evolving workplace. Prior to studying human capital trends at the Conference Board, she researched mining industry labor market trends and initiatives. Lindsay holds a BSc in Earth Sciences and Chemistry from Carleton, and a Master's in Earth Sciences from the University of Ottawa, and an MBA from Carleton University. Welcome to you both. So glad to have a chance to have this discussion with you here today. So I'm going to start with our first question, which is actually, I'll pose a little bit different kind of segments of the question to the two of you. So I'm going to start with Lindsay. And this is in reference to some of the work that you've done with the Conference Board of Canada. So you at the Conference Board have recently completed research regarding what Canadian employers are doing to support employee mental health. Can you speak to the findings of that research, please?
So we have in November just published our report, Future-Proofing Investments in Workplace Mental Health, which I believe the link was shared with everyone. It's publicly available. But a couple of the high points to summarize this research, what we found from survey results from over 200 organizations across the country, as well as 40 interviews, is that organizations have accelerated their efforts towards more holistic and adaptive approaches to employee mental health and well-being, specifically in response to all of the increased focus on mental health brought on by the COVID-19 pandemic. So many organizations have increased the suite of health and wellness initiatives for employees to help them better manage the transition through and moving out of the COVID pandemic. What employers are telling us is that their health benefits plans are still the first line of defense in organizational health and wellness initiatives, but that many have noted that there's low usage of some of the things that they're offering, like employee assistance plans in particular. And these organizations are kind of focusing more on highlighting what they already offer, as well as, you know, digging in a little bit deeper and trying to figure out what actually works and will support their employees, including the adoption of flexible work and hybrid work arrangements. Although these arrangements are typically new, many are prioritizing developing and implementing mental health strategies designed for people who work either at home or in a hybrid work environment. What we also found is that, you know, organizations who regularly seek employee feedback, either through engagement surveys or by sending out surveys on mental health and wellness, could be at an advantage for measuring and determining how the investment in mental health initiatives is impacting their workers. And this gives them a really strong insight into what programs and policies that they can continue to develop on because they're actually working.
Yeah, that's great. Thank you. I'm sure we'll get more into some of the details of some of those as we go along, but that is a wonderful overview of some of the findings that will be really helpful. So Kabir, can you speak specifically to the efforts that you're making to address workplace stress and psychological safety in your organization?
So thank you. Yes. In our organization, what we did was we recognized, just as Lindsay has said, that our mental health claims, so we use disability data, our short-term disability, long-term disability data, and absenteeism rates to determine, you know, where we need to focus some of our efforts. And we noticed that mental health claims were certainly on the rise. In fact, we looked year over year, and it was triple the amount from pre-pandemic to post-pandemic, and it continues to, you know, be on the rise, but stabilizing somewhat. So what we did was we began with a survey for our entire employee population, and we called it a pulse check, and it was designed to be 5 to 6 minutes. So it wasn't a truly in-depth survey of, you know, focus areas that we needed to perhaps drill down further to, but what we wanted to do was get a pulse check, essentially. Just at that point, what are some of the common issues? Is mental health a concern for you? And we even did a score. So out of 5, what would you rate your mental health? And what we had found was that the score was not too high. We had found a lot of useful information. We kept a good spot for anecdotal data. From that, we then created and developed what we call our Live Well program. Interestingly, we found that there was some real big interest in improving mental health and physical health. So we tied those together and developed a strategy around that. And things that we had implemented were, we started with simply communicating the importance of mental health. We got all our leadership on board. Really, we tried to focus a culture on making mental health important. Our Chief Human Resources Officer is a very big advocate for mental health. So she actually had implemented part of that as a strategic priority. So once something becomes a strategic priority, it then becomes elevated. So from that, you know, we use that momentum to help implement various things, which we'll talk about later. But some of the things, just to give you an idea, is Live Well champions. So we actually ask for volunteers throughout the organization to be advocates for mental and physical health, and we defined sort of a job duty for what they would do. And we got an overwhelming response. So we have about 60 people who are doing that in various locations, various capacities, all the way up to executive leadership, who are really interested in promoting mental health throughout the organization.
Thanks so much. You'd mentioned in your response there, Kabir, that there was that association that you saw with your employees and probably thought about more broadly between mental and physical health. So I'll start with you and then we'll go back to Lindsay, but I ask you to speak a little bit more towards what you see as the overlap between supporting both of those areas, employee mental and physical health, or mentical, I guess I just made up a word for the two together, but where you see the overlap and where the support efforts can be impactful in both arenas.
Yes, absolutely. So, you know, physical and mental health, traditionally when we think of mental health, it was just truly focused on just that mental health and what you can do for that. Well, what we've discovered is, research has been done for decades on the importance of physical health. And it shouldn't come as a surprise that physically, when we do initiatives around improving your physical health, mental health can have a synergistic effect. So essentially, your physical health and your mental health can be correlated together. So both improvements in that area can certainly help. So things from an organizational perspective is we ran physical challenges. So for example, we partnered with a company called Propel, which basically offered a ability for our organization to compete with several other organizations in Canada for a defined period where people would post activity levels. And they got creative, and we posted things such as, show us your best hiking outfit. Show us a day when you were doing an activity. And what we really tried to emphasize in our organization for physical health was that physical health is not necessarily jumping on a treadmill or riding a bike, specifically in the gym. All it is movement. Breaking down movements in smaller pieces throughout your day can have a larger impact. And from that, we also tied our mental health strategy with that. We did a lot of education. We do a lot of promotion. We've brought in outside speakers to talk about the importance of how those two factors relate. We've also got our performance leaders or managers, specialized training for them on the importance of physical and mental health, so they understand what it means. And we've encouraged them to promote some of the physical activities along with our Live Well champion throughout the organization. So that's one way that we've really tried to utilize people within the organization to help send that message across. And we've found that our uptake has been really good. It'll be very rare that you'll get a full 100% of the organization, but there's certain benchmarks that we look for. And year over year, we track those benchmarks to see, okay, are we improving? And then we even reach out to employees and say, okay, thank you for participating in this challenge. What would you like to see through just an anonymous survey or a feedback, or post your response here? And a lot of people had mentioned other things that they would like to see the organization do.
Thank you so much, Kabir. That's great. And Lindsay, I'll turn to you to discuss the same topic, both about supports that interact and provide help for people in terms of promoting physical and mental health. And then some of the findings I know from the research you've done actually also speak to how a stressful workplace environment can have negative impacts on mental and physical health, those types of things. So how there's also those impacts from the reverse of a supportive work environment.
Yeah, and I think Kabir touched on a really important point that I just want to reiterate, is that mental health and physical health are linked. There's years and years and decades and hundreds of research papers that show you that there are numerous links between mental health and physical health. And they're on what is referred to as a continuum of well-being. So changes in physical health can impact your mental health and vice versa. And what we've seen in our research is that when primary interventions are ignored, so when people don't have access to the tools they need to help treat their mental health symptoms, they can result in physical symptoms. So things like work-related stressors, and they can lead, to poor sleep quality, gastrointestinal issues, or even substance or alcohol use. And those are the things that lead to more difficult issues for organizations to deal with. And that's where you start seeing, employees leave the workforce and go on those short and long-term disability claims, which is what Kabir has seen an increase in his organization. And there are organizations who are doing some things to counter this. And that's by, providing things like resilience training or increasing access to psychological services, mental health and wellness days. So giving people the time off they need when they're not feeling, 100%, and they just need to take a day to, take care of themselves. And a lot of organizations are really focusing, and today is the perfect day to talk about it, on reducing stigma around mental health in the workplace.
Yeah, that's great. Thank you very much. So I want to turn now to another area of overlap. So when we're talking about EDI and mental health in the workplace, we can see people with mental health disorders as one equity-seeking group that's part of these overall EDI initiatives. But we can also explore the overlap between other equity-seeking groups, being a member of other equity-seeking groups, and mental health supports and challenges. So I'm wondering, and I'll get to you to start this one, Lindsay. So what are the overlaps that you see in terms of promoting mental health in the workplace, and also to support improve EDI and support equity for a variety of equity seeking groups in the workplace?
So promoting positive mental health is important because not only does it give you the opportunity to highlight, benefits and things that you're offering your employees that can help them if they need treatment or access to employee assistance programs, if they need a massage to relax, but it also helps to reduce the stigma, because the more you talk about something, the less scary it is. Another really important aspect when you bring in the EDI lens is to look at your workforce profile. So to understand who is working in your organization can help you develop tools that can adequately meet their unique needs. And our research shows that although organizations kind of understand the idea of embedding equity, diversity, and inclusion into their mental health and wellness strategies, they don't really know where to start, and they don't know how to bring in mental health and well-being, what they're offering, and connecting them to EDI initiatives in the workplace. However, there is a growing body of research that shows that mental health supports have identified individual barriers to accessing, that there are lots of barriers to accessing these types of supports, including cultural and gender norms, as well as institutional barriers, such as a lack of diversity among providers. So the one-size-fits-all approach isn't working anymore, and organizations are looking to their providers to provide, more holistic and customizable approaches to benefits. Other studies show that, 1/3 of employees reported that their unique needs as a member of a diverse community are not being addressed by the current offerings of benefits provided by their employers. So there is recognition that these two things are linked, but there's a little bit more work to do to kind of bring the two together from looking at a benefits perspective in organizations.
Yeah, that's a really good point in terms of making sure that we can have those benefits actually fit the people that they're for, especially those groups that are already perhaps at a disadvantage as equity seeking groups. So Kabir, I'll ask you to speak to your experience with overlapping supports for EDI and mental health, and how those things work together, and some of the things that you've seen as successful.
So in our organization, we actually have an EDI specialist, someone who focuses specifically on that. So I do a lot of work with her in terms of mental health. And the things that our organization have put in place that have really helped to promote EDI and mental health at the same time for this group are what we call employee network groups, so ENGs. So we have several different employee network groups, which are small representatives of certain EDI groups. So for example, we have what we call our possibilities network, possibility, meaning those who with accessibility issues are free to join. We also have an EDI group, or an ENG group, pardon me, for those Indigenous, people of Indigenous background. We have that. We even have a Pride network. So we have so many different ones, and what we've done is, how we've tried to address mental health is, I usually meet with them to ask some questions, to solicit feedback, to find out what's working for you. Oftentimes those groups include people from various parts of the organization that are interested in enhancing that one area. So the information that we found is really, really valuable. Things such as, for example, from an accessibility point of view, things such as utilizing Teams. So our organization uses Teams, and there were some thoughts and questions. How could we be more accessible with that? So we partnered with Microsoft, and they actually have brought in an accessibility consultant to help promote that. And we've got a workshop running where all employees can attend on how to use Teams for greater accessibility. We also are a very big fan of surveys. So recently we did what's called a roundtable, where we would actually solicit feedback from the ENGs to find out, what's working in the organization, where they see improvements. And we've taken that, put it into sort of 5 different categories, And that has been shared with managers, all managers and performance leaders, to share with their groups on ways that we can enhance that area in our organization. All of that in itself, it speaks to culture. And the stronger culture that you have, a more supportive culture you have, will, as a byproduct, enhance mental health. So there's a feeling of trust. There's a feeling that where people could feel and say what they need to say, all falling under the guise of a psychologically safe workplace.
Absolutely. Thanks. Yeah, thank you so much for that. So the next question I'll move on to, and I'll address this to both of you, again, starting with Lindsay for this question. So we've seen a lot of efforts, Bell Let's Talk Day amongst them, to destigmatize mental health issues. However, I've often observed, and you'll see it a lot, that there's efforts, people are still uncomfortable talking about mental health disorders or the messiness of mental illness. For example, we often use the phrase mental health when we're actually meaning mental health challenges or disorders. Like this person struggles with mental health, or like with mental health. So I do believe it's vital, as I mentioned at the top, to speak frankly and really destigmatize that far end of that mental health wellness spectrum where people are really challenged with mental health disorders. So I wanted to specifically have you speak to some strategies that can be used to support and accommodate individuals with mental health disorders in the workplace, and how that relates to the success of other people in the workplace as well.
Okay, so historically, organizations have really focused on the physical aspects of health and safety in the workplace, such as attention to ergonomics or eliminating exposure to harmful chemicals, reducing trips, slips, and falls, things like that. More recently, however, organizations are beginning to examine aspects of the work environment that may be impacting mental health and well-being. And one really great tool that's publicly available, free for any organization to use, is the National Standard of Canada for Psychological Health and Safety in the Workplace, also referred in circles around psychological safety as the standard. And this is a free tool available to any organization. It's a set of voluntary guidelines, tools, and resources that's designed specifically to help guide organizations through the transition of promoting mental health and preventing psychological harm at the workplace. And overall, in our research, we found that, between 20 to 30% of organizations have already started instituting parts of this plan, and it has really helped promote psychological safety in the workplace. So I would say that is probably the best public, free, available for anyone to use tool out there that's been designed with the Mental Health Commission in Canada. So.
Okay, that's great. That's a great resource, and we'll find that and share it, a link to it when we send out the final email when the recording of this session is complete. So Kabir, as Lindsay said, a lot of organizations started looking at workplace health and accommodations for individuals with disabilities or challenges around the physical disabilities or challenges, but there's also room for accommodation and support for individuals with mental health disorders. So I'm wondering if you can speak to what that might look like in terms of creating those accommodations and a strong workplace for individuals with mental illness.
Yes, so with accommodations, that's something that I work with our recruiting team on. So part of the recruitment team, and that's when we're talking about hiring external candidates that make disclose that they have a requirement or a certain disability and whatnot. So what I've done is in that case, because the accommodation, the watermark's pretty high to get to undue hardship. So organizations really have to be creative nowadays, and they really have to think, well, how can we accommodate this? So things such as looking at options for the work, whether there can be rotation of the work, there can be things such as job carving, where you'll remove certain aspects of the job, but it still retains its overall function to help employees. We've done things such as that. We've also tried our best to introduce as many accessible supports for those who have accessibility issues around that. So even things such as software enhancements to allow people to use the screen better, specific headphones. We've done larger screens for people with visionary issues, Teams. We've had a workshop on how to utilize that from an accessibility point of view. One area that is a bit challenging still, and we don't have the solution for it, but it's when someone discloses that they have, for example, ADHD. We've recently had a couple of those where, and it's come out in performance reviews that they've got ADHD. So taking a step back, working with the performance leader or the manager to say, okay, so this is what the employee is going through. What can we do to support them? What are some of the things that we know? And a lot of it is just trying to educate our leaders on how they can make accommodations. Oftentimes, when we're looking to recruit employees or looking to move employees, or when you have an employee who may disclose something, they might be looked at as lesser from some of those performance leaders who think, well, I don't want a weak link on my team. So what we've done is we've done a lot of education to say that accommodation is something that's going to be more and more these days, and helping them to understand that we've got lots of support systems. So we still expect performance. We still expect them to be able to do their job. We're offering them enhancements that allow them to do the job easier.
Yeah, that's a really great point. And I'm going to go a little bit off script from some of the questions we were thinking about at the beginning, but I think, Kabir, you made an interesting point, and something that we're becoming more knowledgeable and aware of are issues of neurodiversity in the workplace. So things like ADHD and autism, and more so how they interact with some of the mental health challenges like anxiety and depression, and where we might have thought of them as in the past as a very distinct type of a condition that had, just to do ADHD, for example, with hyperactivity or attention. We're seeing that these things are all interlinked in very complex ways. And I know, Lindsay, your office has done work both on mental health in the workplace and on and making neurodiverse people successful in the workplace. So do you see a lot of overlap in terms of some of the approaches that are being recommended or that are effective in those areas?
I do, and I actually shared our neurodiversity research, I believe, with the group earlier today. But one thing, when we were talking about, possible questions, we discussed barriers to accessing accommodations for mental health. And when I was reading through our neurodiversity research, I was like, oh, the barriers to accessing accommodations for neurodiverse workers are pretty much the same. And those 5 barriers, it's a lack of awareness and understanding about what neurodiversity or what mental health or mental illness is. It's how individuals who identify as needing accommodations access them. Is it, they need a formal diagnosis, which for mental health and neurodiversity related disorders are, very expensive, very time consuming. And a lot of the times the accommodations that are needed to help people adjust and to accommodate them in the workplace aren't that expensive. So to have this incredibly onerous process for them to access the accommodations they need to do their job doesn't really align. Yeah. There are the things with communication challenges, like, people who are neurodiverse have very direct communication styles. And when you speak in ways that aren't, direct, or you're like, take the bull by the horns, they have trouble understanding what that means in the workplace context, and it can be often misconstrued. Again, as Kabir alluded to, there is that, they try to fit in and meet social norms, and they mask who they really are in the workplace, which isn't good for anyone. And there's that fear of disclosure, that feeling of lesser than, or I don't want a poor performer on my team, when research shows that given the proper accommodations, these individuals can be just as successful, if not more so, than people who aren't neurodiverse or who don't have mental illness. So there is a lot of overlap between the 2 areas of research for sure.
Yeah. And thanks for pointing out how that is also, that overlap also is in that area of challenges to those accommodations. So I'll ask Kabir to speak to that as well. So what are some of the things that you see as a challenge to the accommodations for mental health disorders or for individuals who are neurodiverse in the workplace, and how we can work to overcome some of those challenges.
Yeah, so I mean, as Lindsay had said, the research is bang on with what we're seeing as well. I mean, you know, neurodiverse is really hiring, if we start from the beginning, just hiring someone who may identify as neurodiverse. I really appreciate that. So recently, we had a situation where a potential candidate has disclosed that they had dyslexia. And it was for a position that actually required a lot of numerical calculations and a lot of things. So she had said that just to be upfront about it. So we were really happy that she had actually said that and required the accommodation and worked with her to try to figure things out. So for example, you know, modifying parts of the job that are not significant in some ways to impact the job. But a lot of that is still very challenging. You know, for me to say, yes, we can just simply modify the job and things will be fine is not necessarily how it works with certain teams. So really bringing the manager on board, bringing the leader of the area on board to understand the importance of where our organization's heading, where Canada's heading, in fact. And this is going to be something that we're going to see more of in the workplace. People identifying as neurodiverse, people coming to you and saying that I've got this and I need help, I can't focus right now, or I feel too overwhelmed. And what supports can we offer? One of the big supports that we do have for those positions that allow it is the hybrid workforce. So the flexibility to be able to work from home. As a typical example, some individuals who are neurodiverse might feel anxiety and pressure to come into the office because they know they have a drive, they know they've got a whole bunch of things to do afterwards. Having that 1 or 2 days from home, whatever the organization has agreed upon, can really help to decrease that anxiety and can really help to allow them to feel more at ease and still perform in the same way. At the end of the day, it's about getting the job done and not sort of where they work, but it's about more of what the job entails and are they meeting the demands of the job.
Yeah, that's a really, I appreciate the advice that you've given there, and also the point that you're making around how this is the future of our workplaces. So where we do see those individuals that Lindsay mentioned that might be resistant to these types of changes, or maybe it was Kabir that mentioned that there are sometimes those leaders that are resistant to think about the fact that this is where the workplace is going and that these types of identification and accommodation are going to be more frequent in the future. It's an interesting thought, and certainly we're in a bit of a different time in terms of understanding these things and talking about them and diagnoses. So certainly the more we can learn about it, and discussions like today as a start are really helpful. I will remind everyone, I know Karen just posted in the chat that we're getting towards the end. I've got one more question here for our panelists, and then we'll be moving towards the question and answer session. So if you do have questions that you'd like to see answered, you can message me directly in the chat. You can just select my name from the drop-down list to Jamie Mayoh-Bauche and send me the question, and I'll be happy to share it with our panelists. So turning to our final question in this initial portion, I'm going to start with Lindsay, and it's actually following up on something Kabir just raised. You guys kind of made everything flow together really nicely here today in terms of the questions, but that's the issue of hybrid work. So I know you're doing some research and in interrogating the what hybrid work looks like now and where it's going in the future, both in these cases for potentially accommodations for people with mental health disorders, but also just generally, we've seen this shift with the pandemic to more home-based or hybrid or different working environments. So I wanted you to talk a little bit about what does that impact of working from home or hybrid work for individuals with mental health challenges and in equity-seeking groups in general?
It's a very long question, but so there's a ton of research coming out of the pandemic showing that employees appreciate the flexible work arrangements, that they wanted, that they will take significant pay cuts if they're given the option. Like if they have to go back to work, they would take a significant pay cut to be able to stay home. You know, over 50% of the workforce, if they were forced back to the office full time, 5 days a week, would consider looking for other jobs. So there is a ton of research that this is what all employees want. And one thing about accommodations is that just because you're implementing an accommodation for one group of people or one individual doesn't mean that accommodation won't help others. Like, for instance, providing interview questions in advance for someone who's neurodiverse so they have time to prepare. Well, I think everyone would benefit from that. So accommodations, when you're looking at requests, think, would this help my entire workforce in general? Like, noise canceling headphones or softer lighting. A lot of these things aren't expensive and they make the workplace a better place to be. And hybrid work is one of those things. Like, many people benefit from hybrid work. Yes, there are some who, would love to drive into the office every day, but me personally, living in Ottawa right now, it's snowing outside. I am very happy I am working from home and don't have to sit in 2 hours of traffic to get there tonight. So it is a benefit for a lot of people. And there has been increasing organizational interest in flexible work arrangements to better support employee psychological health. So flexible work arrangements are linked to positive financial outcomes for organizations as a result of numerous factors. And this includes reduced absenteeism. So on a snow day in the past, I may have not gone to work because it was snowy. Today I worked from home and it was fine. And it can also help buffer some of the stressors of productivity demands on well-being. So when you're given that time to focus, it reduces a lot of stress, especially if you're struggling with your mental health that day and don't really want to talk to anyone else, don't want to get dressed for the office, and you just want to sit at your desk and focus. You can do that very easily at home. However, flexible work can also have some negative impacts, but they're significantly reduced when you start looking at the hybrid working model, where you're still getting those social interactions in the workplace. And remote work, there is some link between remote work and emotional exhaustion, especially if you're sitting on Zoom calls, 10 hours a day for 5 days a week. That's probably not good for anyone's mental health. So instituting, meeting-free days where people are given that focus time is also a really good way to mitigate some of those stressors from a remote-only work environment, if that's what your organization is looking at.
Yeah, absolutely. Those are great points. Thanks so much. So Kabir, I'll have a little bit of a different take on the same question, but can you talk about your experience with enabling hybrid work and the role of trust in enabling that and how that relates to psychological safety in the workplace?
So with our organization, we are a hybrid workforce, and how our hybrid workforce is designed is that we let our performance leaders manage the days with their teams. So we, if a performance leader says, okay, well, this is a great day that we all meet in the office to discuss this, then that would be the day for the team, whatever works best, because we know that each area functions differently. As Lindsay had said, what we saw in the pandemic, people shifted completely to remote 5 days a week at home. And we did see a lot of we didn't have a decline in performance at all. In fact, what we found was people were actually working longer because their computers were on. It was easier to sit there. Whereas when you're driving home, you oftentimes don't log onto your computer at the end of the day. So part of that was definitely an emotional exhaustion and created a lot of mental health concerns. We did hear from some of that. But in terms of hybrid workplace and how we actually manage it best is through ensuring that the performance leaders feel they're able to trust their teams. So, what we focus on is not necessarily how many hours have you clocked in. It's an outcomes based. So if you've got a project to do and you've got a deadline, so long as you're meeting those deadlines, so long as you're continuing forward, there's no need for a performance leader or a manager to sort of question that. If you're trying to micromanage with hours and minutes, you're going to have a lot of challenges with that. And that's what some of the latest headlines that I've read have indicated, that it's very difficult to manage hybrid workforces without trust, without the feeling that leaders can trust their teams completely to do everything. And the other thing I'd like to say is modeling by behavior. All the senior leaders, all the way up to the top, our CEO, all rotate. We all have hybrid work schedules. They all work from home. We've all taken Teams calls from where we've had, executive meetings and half the people are on Teams. So doing that, modeling that behavior really, really works. And, depending upon the type of organization you have, you can schedule it to the way you want, right? So hybrid is so flexible. You can have it where some employees have this schedule, some employees have this schedule. And, we also know that in some organizations, because we're a credit union, our branches, they don't necessarily, the tellers or the front line there, they don't have the flexibility of working from home. But what we are doing is with our senior financial advisors in the branches, we're investigating ways that they could work from home. This actually did work during the pandemic. So some of them were continuing to take their calls, we're continuing to provide our members with service from home. And it was quite simple. So we're still investing in that technology and figuring out the best way to utilize that. But it's a work in progress. And our perspective is, and our point is that hybrid work is sort of the future of work. The pandemic, most organizations were already shifting to that domain, but the pandemic really just propelled it. And it gave us an opportunity to try it out and what works best. And so for us, it seems to be that hybrid works best, not necessarily a fully remote workforce. It all has to be dependent upon the type of work and what the culture is like.
That is a really interesting point, and it does, as you mentioned, some of the headlines that we've seen lately. There are some, organizations that are attempting to manage remote or hybrid work through, I guess we could call it kind of spy software that they're putting on their employees' computers. And you can think about and extrapolate where that might go in terms of the mental health and the trust and the psychological safety of employees. So it's good to know that there are approaches that are built on a trusting and safe in culture and environment, and that they work and are productive. So that's great. So we now have come to the point. Thank everyone for your patience in terms of your questions. So I am going to be opening up the discussion to audience questions and answers. I have invited you to send me questions in the chat, which is wonderful. And I see a number of you who have done that. So I'll get to those right away. But we've had a request from Trish LaFontaine to directly unmute and ask a question. So we're going to get started off with Trish.
Thank you very much. So I work in a place where my physical disability has been accommodated by me working at home, which has also improved my mental health. But I also work in a place where we deal with a lot of negative stuff. So I work in Indigenous relations. And so we often deal with we get racist letters that have been sent to the minister to handle. We deal with, the unmarked graves. We deal with MMIWG. And so it's almost like that kind of workplace forces you to talk about mental health all the time, right? Like we do. We have to, because it helps us cope with the stuff that we work with. But the question I have is, so when we take a sick day, or let's say we need a mental health day, are any companies offering the mental health day? Because I know, we get this menu that says, is this a doctor's appointment? Are you sick? Or, there's a couple of options, but the mental health option isn't there. And I think that would help in destigmatizing mental health and really pointing out the importance of it for a healthy, productive workplace. Thank you for taking my question.
Thanks so much for that, Trish. That gives a good perspective in terms of the pressures that exist in some particular workplaces. So that's something to really think about. Lindsay has done some of the survey work around what different organizations are doing. So I'll turn to Lindsay in terms of looking at, is this a practice that is applied, and is it something that's growing?
It's definitely something that is applied and is growing. And I think it's becoming more recognized that the sick day, there's some stigma associated with that. So I know a lot of organizations have started shifting the language to, health and wellness days or wellness days, which are days that you can take to take care of your whole body, like that more holistic approach to taking time off when you need it to take care of yourself. So yes, it is something that we see kind of shifting. And, there are some organizations who have like this number of sick days and this number of mental health days and this number of floater days. And, if you just kind of group it all together and call it health and wellness, it gives people more flexibility to customize and take the days off that they need.
Perfect. Kabir, did you have anything to add?
Yeah, I mean, for our organization, we have a couple of options that we've implemented. So one is called a day for you, and 4 is like the number 4. And really that's for anything that you want to do for yourself. So you could use potentially a mental health day for that. But we also have, we don't call it sick days as Lindsay had mentioned. Our organization calls it, personal days, personal off day. And then we usually have a code where you would indicate what that was for. And during the pandemic, the COVID-19 pandemic, we actually did some tweaking in our system because we discovered that, yes, people were off, but they were required to isolate, for example, for 5 days. So we had a code. And we're now using that code to indicate, mental health or taking time off or whatever it might be. I definitely think organizations are going to certainly build this in. Knowing that some days are harder than others. We've all been there. We've all woken up in the morning and just not felt right, and the saying that's going around, it's okay to not be okay. So, that type of bringing that culture in, I think will really help to destigmatize and make you feel like you could take that sick day or that off day when you need.
All right, excellent. Thank you. So the next question is about, in particular, the public sector. So I'm going to start with Kabir. Kabir, you were working in, like you said, the credit union sector. You've also worked kind of in the more distinct private sector. We at JSGS do a lot of research around credit unions and co-ops and consider that part of an extension of the public sector. So I'm curious if you have particular insights around working in that credit union setting as opposed to other businesses. And then Lindsay, I'll ask if you have any information about what government or other public sector employers are doing, if there's any particular difference or if there's a lot of overlap. So I'll start with Kabir.
Yes, that's a good point, Jamie. The credit union culture is definitely different and is very similar to the public sector. And previously in my experience, I did work for the Vancouver School Board, trying to work on mental health as well. So definitely, I mean, if I talk about my sort of the years that I was at the school board, it's not necessarily easy. It's challenging in that aspect. You have a lot more stakeholders that you really have to work with. And there's a lot more partnerships that have to be made in order to enhance mental health from that, because definitely you're starting with an education campaign where everyone has sort of a different take on mental health. But in our credit union world, it's been very supportive. All the credit unions, all the way across. I am part of a larger credit union conglomerate, and we all share research. We all call each other, talk about ways and strategize that we can, improve mental health in the workplace. So I'd say definitely some of the starting points have to be, with the senior leadership team and really getting started. One of the best ways, and what research I've shown, or I've seen, pardon me, and Lindsay could probably attest to some of this, is, you don't know what your population is really, what they think of mental health. So starting with some sort of a survey, some sort of a baseline measure, and using that baseline measure, and then, every year sort of taking a measurement of that to see, are you hitting the mark? What can be done? What are ways that we can make improvements? There's a really fantastic survey called Guarding Minds at Work, and that's through the Mental Health Commission of Canada. And it was brought on by researchers from SFU, and that one gives such great insight. I've found from what I've read that it's been very, very helpful in the public sector.
Okay.
But I would warn you with that type of a survey, it definitely opens up all the wounds. So it will be hard conversations at first, and it's, by nature we don't want to conflict with anyone. There are some hard conversations that have to happen, but this is the stuff that needs to get out of the way in order to make way for sort of the new world of work, which is going to involve psychological safety at some point or another.
Thanks so much. Lindsay, did you have anything to add?
Just to kind of build off something that Kabir kind of touched on, but is super important, so I just want to reiterate it, is that leadership component, is having, you know, your leaders really invested in creating psychologically safe workplaces and invested in, you know, reducing stigma around mental illness. And I am sure that a lot of organizations are doing things today because it's Bell Let's Talk Day, but it's really continuing that conversation throughout the year and just showing that it is an organizational priority and that the leadership is taking it seriously, has a huge impact on, you know, the overall reduction of stigma in your organization, as well as, you know, creating those psychologically safe workplaces where people aren't afraid to disclose if they need to take, you know, a day off because they're not, you know, feeling like coming in today and they need that day to just refresh and take care of themselves.
Yeah, absolutely. All right, I'll move to the next question. It asks, how can we balance mental health and wellness with performance and capacity to work? So if a person is not meeting the requirements of the job and we don't have the flexibility to change the duties, and how can we ensure our accommodation of one employee doesn't have a negative impact on the mental wellness of someone else if we are shifting some of the job duties to another employee? Kabir, did you want to get started with that one?
Sure. That's a tough question, right? So sometimes you might have an organization that doesn't allow that for whatever reason or another. I mean, I guess the best way to do it is to take small steps and see what are some of the little things that can do. You know, if you come out with large scale steps or you're really trying to move the needle significantly at first, it's always a hard blow. It's always hard. So really starting with some of the small ways, working towards, well, what can we do in terms of accommodation? Would this small step work to help you, you know? And I think making those little strides will definitely help to sort of shift it. But overall, it's going to have to be, what I'm hearing in that question is a lot of education, a lot of, you know, re-education, a lot of explanation, a lot of understanding around it, a lot of sort of making people kind of understand the importance of health and wellness and where we're heading. I think that's something that will be a good start, and then to help shift the needle a little bit in that aspect.
Lindsay, did you have anything to add to that one?
No, I think Kabir nailed it. So.
Okay, perfect. All right, this one's maybe a little bit in the same vein, but it's asking about how have other organizations dealt with the resentment between employees required to remain in the workplace while other employees were required or allowed to work from home 100% or hybrid, like Kabir had mentioned. Depending on your role, it's not always an option to be working at home part of the time or all of the time. So they're asking about other organizations. So I'll put this one to Lindsay, and then we'll see if Kabir has a follow-up.
So that's a really important question, because that is something that has come up. Like, how do you make it equitable when some roles can be done at home and some have to be in person? And that's a tricky one because the nature of some jobs require that in-person component. But some organizations have tried to, you know, create some flexibility around what that looks like. So whether that's instituting 4-day work weeks and allowing people to work, you know, 4 10-hour days instead of 5 8-hour days, making it easier to switch shifts, you know, for people in the food service industry, for example, and giving them the flexibility to, you know, like swap with a friend if they can't meet something or they're not feeling well that day. You know, looking at job sharing or, you know, rotating schedules, like flexible work hours is another thing that organizations are doing where there's that in-person component. So, you know, allowing people to schedule around when traffic is really bad in downtown Toronto is one thing we've seen some organizations do. So things like that. So trying to incorporate flexibility into the workplace, even if they still have to come for an in-person role.
Excellent. Kabir, do you have any other things to add?
Sure. I mean, I think a lot of that is, you know, there's a big misconception. I have to say that sometimes people think working from home is a dream, but you know, it's not always the case. The expectations are still such, and like I had said, in some cases you end up working a lot more simply because you're here and you lose track of time. I do like what Lindsay had said. Yes, so trying to be fair and equitable. It all depends on the role, and for those employees who feel like it's not fair, I mean, having a conversation with them. What would you like to see? Because in some cases, I think people have to understand that your role doesn't allow that simply because of the nature of the role. But maybe we can do what's called an AWA, which is an alternate work arrangement for you, such as 4 days. You work 4 days and then every Friday you have off, you work 10-hour days, or whatever that might be. At least looking at some sort of options to help do that for some employees, will at least have it. I think having a conversation there is going to be important, because education is what you really need in that aspect to say that, okay, well, this role allows it, and this is the nature of this type of role. If you're interested, perhaps something in the future might come up in that area, or if you're looking at other opportunities that have that, we can always help you with that. I think people have to sort of get, I don't want to say get over it, but it's some are going to be this way and some are going to be that way. And it's simply the roles that are part of that.
Yeah, thanks for those responses. And I think consistently what we're getting to is that that idea of flexibility and responsiveness to the individual situation, right? So that as that becomes a norm in the workplace, that decisions are made based on the role, the needs of the organization, and the needs of the person in that role. That becomes more of a norm, and people start to understand that. That can make a lot of sense and a lot of difference in how we roll out these hybrid programs as well, rather than a one size fits all. All right, so I've got another question here, this time about kind of how to get started with a mental health strategy within an organization, but specifically, and I think this is relevant in the public sector organizations, particularly engaging senior leadership. Sometimes in the public sector, senior leadership can be many levels up and include deputy ministers, ministers. So do you have advice for getting senior leaders talking to each other and, have kind of walking the talk, like Kabir was talking about, in terms of a mental health strategy for an organization? I'll throw that one to Kabir and then we'll come back to Lindsay.
Yes, I mean, that's the bane of every sort of mental health individual who wants to get it started. So the best way I would say this is data. Show the organization data. You need to back up your data. You need to back up your request. And you need to be sort of concrete with some of those requests. Like, what are you exactly asking for? Mental health programs, in an organization can range from simple things that aren't very costly to really extravagant things. It all depends where you want to go. But I think looking at your short-term disability data, looking at your long-term disability data, looking at anecdotal feedback on the organization, looking at burnout rates, looking at absenteeism, put it all together in some sort of a format and present the data and say, this is our organization right now. This is what it costs. This is what our renewal for short-term disability is going to be like. It's going to jump $1 million because we've got senior people going off on long-term disability. You need to show that data, and that's really what speaks towards making the shift. Even other things such as the research that shows, what other organizations are doing. And I can even tell you from a recruitment point of view, we've had employees who at our organization have, when we were looking to recruit them, have asked specifically, what do you have in terms of mental health and wellness? The workforce today is not the same one that it was, maybe a couple of decades ago, who was looking for pay and hours. They're looking for, what am I going to have in terms of balance? So all that data, all that information has to be put together, in a well-designed format and then presented to senior leadership. And to say, well, this is, you can either make a decision on the organization to make it a better place, or we can just continue with these the way they are. And I think that sort of really has to hammer things home. And then once you get sort of the buy-in, that's where the heavy lifting begins. And like I said, one of the best ways is starting with a survey, figuring out what your baseline is and going from there. And continuously sharing those results. I think if you share the feedback, the small stuff, the small improvements, the little wins, all that stuff, it only helps to build the program. We at our organization do an annual organizational health index. And it's a question that goes out to all employees. It's done by KPMG. So it's a survey that goes out to everyone, and it gives us a scorecard as to how healthy our organization. Mental health is a piece in there, but it also ranks other things. Perhaps that's your in terms of gathering data and in terms of looking at that specific area and focusing on it.
Great, Lindsay?
And just to add to the data piece, that's also super important for organizations to understand. Like, I'm sure a lot of senior leaders don't know every program or policy they have around mental health. I've spoken with organizational leaders who are like, Lindsay, we're doing great at mental health. We have 82 things. And then I go, great, which one's working the best? And you just get blank stares. So understanding which programs are being used is really important, because having 82 things, like, there's a point where there are too many choices and too many options. So focus on the things that work and focus on the things that have the biggest impact. And that's where you'll see, organizational leaders buy in, when you can show them data like, hey, we have this program, 40% of our workforce is using it, or 40% of our workforce has, reached out to our EAP, or whatever it is. And having the numbers behind it can help make the case to those really senior leaders. So it's that data-driven decision making and making informed choices that will help move your mental health strategy along.
Great, thank you. So the next question is around mental health and cultural health and the intersectionality of both of those. So this individual says, I worked in an Indigenous organization where 5 cultural leave days were part of the annual benefits package, but I've not seen it elsewhere. Is this a trend you're seeing? And if so, what are some other ways other organizations can get started? So I'm just curious if you've heard of cultural leave days and what that looks like, or other related types of services. Lindsay?
Yes, I have seen it, and I see it becoming more prominent as the workforce continues to diversify. The way I've seen it is as like a statutory holiday replacement. So maybe you don't celebrate Christmas, but you celebrate something else. You can use your statutory holidays for Christmas and Boxing Day, further down to celebrate Ramadan, or the Chinese New Year, or the Lunar New Year, or whatever kind of fits with your cultural values and beliefs. So I have seen that, absolutely. And it is a shift that we see more organizations making as the workforce continues to diversify, and that not everyone, follows all of the traditional holidays we get off in Canada through statutory holidays.
Kabir?
It was interesting because we had actually just discussed this very topic in the earlier portion of January, because we had engaged our ENGs and we got some feedback that had said, a lot of people celebrate Christmas, but I don't celebrate Christmas in particular. But I do celebrate another tradition. I do celebrate something else, but I don't get a day off for that. Maybe, and this was just feedback, maybe we could look at some ways of that. So this is something on our radar that we are looking at. I actually love the term, cultural leave days, and I think that would be a great thing to implement, because there are so many different holidays, and we recognize that, look, I can't change the statutory calendar. I can't change the way it's set across federally or provincially, but what we can do is implement other things where we respect your culture and you can take time off. Sometimes, I know for Lunar New Year, it's quite a big celebration, and oftentimes people from that culture generally take a good amount of time off to celebrate with their families. So recognizing that and making sure that we're appropriate from that angle, I think is going to be something that we're looking forward to in the next little bit.
The next question I'm looking at here is about that reduced work week. So that was mentioned as one of the options in terms of flexibility for different individuals. So the question is, what are your thoughts on a reduced work week in terms of overall health, mental and physical, and productivity? So that could either be, and then maybe talking a little bit about the different ways that can work, either compressing the work week into 4 days, or just losing 1 day off the end, and just having a 4-day work week with no reduction in pay. Kabir?
Recently, I read a headline. I have to say that I didn't read the whole article, but I read a headline that there's a movement happening on 4-day work weeks or a shortened work week. And it's interesting. So I think it really has to depend on your organization. I mean, businesses will have to operate, and some businesses need to operate, 5 days a week. But in terms of mental health and in terms of giving you that time off, absolutely, I think there is going to be some beneficial impact for some. For others, it may not be. For others, it may feel the opposite because they've got deadlines to meet, or they may end up just working extra on those days. It's really going to have to depend on whether it works for the organization or not. And I think, we do have what's called our alternate work arrangements, where for some people, they enjoy working, other days, like 4 days a week, and they can manage their workload. For others, they have elected not to do that for whatever reason. But I think it's, like I said, it's really going to have to depend on how that fits into your business model and whether it's, doable or not.
Lindsay, can you speak a little bit to what you've seen in terms of this being adopted?
Oh, I've seen it work in, a bunch of different ways. The most common is the compressed work week, where you still work the same number of hours in a lower number of days. Whether that's, you work 45 minutes every day, extra every day for 9 days, and then you get the 10th day off, or whether you work, 40 hours in 4 days and get the Friday off or the Monday off. And I've seen that work really well, and it's been really popular. I spoke on a panel, 2 years ago with a municipality in Ontario who had implemented 4-day work weeks. And they said that it was a huge bonus for their employees based on employee retention, which is a topic we hear about all the time. It's something that keeps their employees there, whether, even though the city of Toronto paid more, they would have to drive there and work 5 days a week. And they just said it wasn't worth it. And they really appreciated the 4-day work week. If you're looking at reducing, the number of hours in a week, there's not a lot of data in Canada to support that. But if you go across the Atlantic Ocean to Europe, there's a growing body of research showing that, the 4-day work week or 6-hour work days, however you want to look at it, has really positive impacts on mental health, because it gives people more opportunities to, spend time with their family, decompress, and they've linked it to more positive mental health for the workforce. And I don't think they've seen a drop off in productivity for knowledge-based workers, at least.
Yes, it's a really interesting area. We seem to be very kind of stuck in our ways in terms of the 5-day work week in North America. My kids' school actually with COVID went to a 4-day week and stayed that way. And it's been interesting in terms of how that opens up time for rejuvenation and a little bit more rest on the weekend. So yes, it's a very interesting area as well. So I will ask for another call for if there's any last questions. I've got a few questions here that I will pose before we wrap up here in about 10 minutes. But if participants wanted to share any others, I do see a number of questions in the chat around the resources and having them shared. So I know Karen will be sending out all the resources that we are able when she sends out the link to the recording of this session as well. I want to touch on something, Lindsay, you and I, where we were, the four of us, you and I and Kabir and Karen were chatting a little bit about before we came into the session here today. And that is the idea of the impact of mental health and challenges and mental health supports on, you had mentioned absenteeism and presenteeism. And I wonder if you could speak a little bit about the concept of presenteeism, because I'm not sure if that is something that everybody is familiar with. And when we're putting together those types of stats for the, our leadership teams, what does it mean in terms of the challenges that absenteeism and presenteeism can present in a workplace?
Sure. So this is a new research project we've just, started to develop, and it's looking at the impact of mental health on absence rates as well as presenteeism, which is essentially when you come to work, but you're not feeling as productive as you would on a normal day. So on those days where, you should have maybe taken the day off, but you didn't for whatever reason, whether that's you're not paid for your time off or you don't have any sick days, or you didn't want to get a doctor's note and sit at the doctor's office for 6 hours to get a note so you can miss work when when you have a headache or you have a migraine. So it's coming to work when you should have taken the day off, but didn't. And you're not performing at, your optimal level. So that's how broadly we're defining presenteeism. When our research comes out, there will be a much more eloquent definition that has been reviewed by our research advisory board and everyone. But what we're looking at and we're trying to identify are what is making people come to work when they're either physically or mentally unwell. And are there organizational practices and policies that we can put in place to help mitigate that from happening? Because presenteeism, specifically related to mental health, will have huge business costs in the future. And there's a crazy stat from the Mental Health Commission of Canada that says, it could be higher than the cost of all healthcare in Canada by 2030. So the cost of mental health is a real issue for the Canadian population as a whole.
Wow, yeah, that is a very impactful stat. That's interesting. Kabir, did you have anything to add around absenteeism and presenteeism?
I think that is a pretty amazing stat. So, and knowing about presenteeism, I know exactly. Sometimes in our workforce we look at that. What we're trying to figure out, one thing that we had a discussion the other day was when we look at our absenteeism rates, is it truly reflective of what the workforce is? Because with the hybrid work model, as you had said, Jamie, if I'm not feeling too good, I might stay at home or work from home, but still be on the computer. So technically I'm working, but is that defined as presenteeism? Am I really working, or am I just sort of a warm body in the chair, not taking a day off? Whereas if I had to come into the office knowing that I wouldn't. So trying to sort of define that and try gather data on that, it's a bit of a hard one, because how do you sort of track who's being, what presenteeism actually is? And just looking at it, I think one of the ways that we're going to start with is at least absenteeism data, and maybe trying to figure out if people are away from work, or if they are reporting not feeling well, maybe we still track that anyways, working from home. Could that be under there? So a lot of exploring, a lot of investigation that we're trying to do on our end to capture that very topic there, presenteeism.
Yeah, it's certainly an interesting topic, and it also plays into kind of conversations we're having around COVID-19 and the pandemic, and whether we want, in the past we might have had people coming into work when they weren't feeling well, just because that was the expectation and we didn't, and that was what people did. But then that can, snowball into other people in the workplace being ill and have costs of its own, right? So I've got another question here. It's asking, should we encourage staff to take the full day rather than work from home if they offer to work from home when not feeling well mentally or physically? So I think that this kind of follows on what you're talking about, Kabir.
Yeah, I mean, if you're not feeling, like the way I look at it is if you're not able to really perform your job duties and you're just sort of there to try to say or try to make face, to say that, look, I'm here for the organization. You've got to do what's best for yourself. And that having that conversation as a manager with your team to say that I've had my team, I've looked at them, they've said, okay, I'm not feeling so good. And I ask them a couple hours later, how are you feeling? They're still not doing good. Please just take the day off because you're not doing yourself any better. Just rest for today. And then tomorrow you can log back in. I'm sure you're going to feel a lot better. So I think really, working with that, because it's hard to say half a day. Sometimes people are struggling, to get to that point where they're trying to make it half the day, but really what have they done? They're just, almost like just being here just for the sake of being here. Yeah. So I think, working with the person individually is going to give you your best result.
Lindsay, did you want to add to that?
No, just Like if you're sick, you're sick. If you're not healthy enough to go into an office to do your job, you probably shouldn't be working from home because you're not taking the time you need. And what you're doing is actually prolonging your illness because you're not taking care of yourself properly. And I know I've had those conversations with my team where I'm like, because we are 100% virtual organization, no one has to go into the office, so there's no risk of spreading, colds around the office. But if you're sick, you're sick. Take the day, take care of yourself, take time to recover, and come back fresh when you're feeling better.
Yeah, absolutely. It is certainly is a shift in mindset from where we might have kind of had that idea of, getting to work at all costs and having people try to aim for 100% attendance or something like that.
Mhm.
Okay, well, going to turn to another question here. Many people are worried about using up all of their days, which may be why they're offering to work from home. Could forcing them to take a day have more negative of an impact?
Yeah, that's a good question. I mean, to be honest with you, our organization, we actually don't have a cap on that. We don't have a cap on any sort of time. What does happen is if you have 5 consecutive days of absence and sick, then it switches to short-term disability. So I think a lot of people are, concerned because oftentimes short-term disability is a reduced pay, whereas your sick time is generally at 100%. I mean, if an employee really feels like if they're not able to do their job and they're truly sick, they're not doing anybody any favors. We know that, Jamie, what you said, I mean, nowadays, if you were sick and you were to come into the office, it's almost like taboo. So you wouldn't be doing that because they would look at you and everyone would say, you need to go home. No one wants to be sick. So I think you'll have to work with that person and figure that out, ways that can be done. Maybe there's another way to sort of make up the hours so they don't feel like they're taking all their sick time in that. But then again, I always look at it from this point of view. If employees are taking a lot of intermittent absences, there could be a sense of an underlying issue. So I always encourage the manager to have a conversation with that employee to see, I just want to make sure you're okay. I see you run out of sick time already. And if it's just a combination of things that were unfortunate, then that's unfortunate. But sometimes, and I found most of the time actually in our case, it's an indicator of a mental health issue. And it's interesting because you'll discover what's going on when you have a conversation with them. Many people don't want to come forward and talk about it, but sometimes it can open that conversation.
Yeah, that's a great point. And I've got a couple more comments from a few people that are basically to the same topic around the concern and stress that it puts on people when there isn't the availability of paid leave, either for mental illness or mental health leave, or just sick leave in general. So it is, I think, one of these key areas in this discussion about having supportive and psychological safe workplaces is making sure that employees aren't put in a difficult situation where they're, either having to choose to go. And one person mentioned that over this flu season this winter, individuals were coming into their workplace sick because people had prolonged COVID bouts earlier in the fall and then had used up all of their sick days. So we're being put in these situations where employees are being asked to choose between, potentially making other people sick or not taking care of their own health or kind of violating the guidelines of their workplace. So that, I think that's one of the things that needs to be addressed in terms of a psychologically safe workplace. Was there any comments about that?
I can say that, you're absolutely right. A psychologically safe workplace will make you feel, if it's truly like a psychologically safe workplace, will make you feel like, yeah, I could take the time off. I could talk to my performance leader, my manager, and say, look, I'm out of sick days. I've only got this time here. I've only got so many days left or whatever it might be, and I'm not feeling well. So is there something we can do? Is there something that we can work around? But, aside from that, I think organizations at a higher level really need to look at that. Perhaps at that point, 10, let's say hypothetically, sick days is not enough. Perhaps you need to create a different model where you're looking at enhancing sick days, but then also having things where short-term disability can help to kick in or at a later point if it becomes excessive. I think there's going to have to be some exploration. And, this past flu season, really did a number on a lot of organizations. Ours wasn't spared either. We had situations where some of our branches were running on skeleton crews. But we encourage our employees to really just not come into the workplace if you are sick, because what it does is it'll only cause a snowball effect. So maybe some organizations who have stricter policies around that will simply have to take a look at enhancing those and using the guise of perhaps mental health. Because I would know that if I didn't have the ability to take a sick day, that would certainly not be a good feeling for my mental health, especially if you're truly sick.
Yeah, absolutely. Thanks for that. So we are coming to the end of our time here for today, just about running into 1:30 there. So I did see that there was a comment from Melinda around some of those pieces where her workplace is structured in a way that the paperwork and the way that files are open around disability does not allow for, it doesn't have flexibility to allow for, certain declared disabilities, and you keep having to reopen paperwork. And I know we discussed before the need to be flexible in terms, sometimes the paperwork is necessary, but the need to be flexible. So Kabir, did you want to say last couple of words to that? And then I'll ask Lindsay before we wrap up.
Yes, definitely. I mean, the organization needs to work with their disability provider to figure out what works best. And I know oftentimes it's a model that they use. So it's unfortunate. Sometimes you have this and then you have to submit paperwork again and the claim becomes reopened. It becomes a pre-existing claim. If you had the same claim within 6 months, it opens. I think working with your disability provider, their benefits team needs to work with them to figure out a way that, look, if this is the issue, then what is a solution around that? What is a way that we can work to make it easier for our employees? One of our pillars at our organization is employee experience. So we really, really make sure that the employee experience is taken care of. The last thing we want to do is not have employees truly take the time that they need to go off because it's just simply too difficult. So working with them to figure out a way, and I've done it plenty of times, to say, listen, we have to fix this process because it's just not fluid enough. And it's creating a lot of backlog on our end, and we need to make sure that we can manage that going forward. I think that would be a good place to start for something like that.
Okay, perfect. Did you have anything to add, Lindsay?
I just think organizations should consider making their, disability accommodation process a little bit more easier to access and accessible for their employees, because you want to encourage people and provide employees with access to the accommodations they need to effectively do their jobs. And that will help not only the employee, but your organization as a whole. And will help to reduce some of those things we've talked about before, reduce stigma, help, increase psychological safety in the workplaces, promote positive employee mental health. Like, there are huge benefits to making the accommodations process a little bit more accessible to everyone.
That's really important point. And I know, Lindsay, you mentioned in one of our initial conversations, even the option for some types of accommodations, just providing a list to employees in terms of these are accommodations that are available. You don't need to, have any diagnosis or anything specific, but these are things that we can provide, whether it's different lighting or different types of communications or whatever it is that's available to everyone, which actually overlaps with the kind of the concepts that we use in education around accommodations, is that if we can be providing them to our whole core classes or all the groups of learners, that's going to be effective in meeting the needs of individuals with specific needs, but also making it a better experience for everyone. So I want to close here by thanking you both so much for joining us today. Thank you to all of you who joined us on this call. This has been really great. I just wanted to let you know that if you've enjoyed this lecture, that you can keep an eye on the JSGS events calendar, where there's upcoming events being promoted. We have a few coming up right away on January 31st, Rethinking the Way We Farm with Dr. Beena Agarwal. February 9th, Conservation Doesn't Just Happen, Protecting Lands and Waters Through Policy Engagement with Katie Morrison. And if you're interested in our academic programs, we have several information sessions coming up in February. So all of that information about our programs and events is in the JSGS events calendar, and Karen's going to post a link in the chat. But I'd like you to join me in a big round of applause using the Zoom reactions, or if you want to unmute and give some real hand-on-hand applause, you can do that for our presenters, Kabir and Lindsay. Thank you so much today. It was a great conversation and enlightening for all of us. And I saw thanks from people that had to sneak off early. So thank you everyone for joining, and I hope you all have a wonderful afternoon.